We all now know how serious this national emergency situation is. The Prime Minister has asked the country to act as though it is at war with a common enemy, the virus. The NHS is now on a war footing. We could be hit by a huge surge of COVID patients in days. In this situation, I, as your CEO, have two tasks. Firstly, to make sure that we instigate command processes that enable our teams to be as prepared as we can for the tsunami that is about to hit us. Secondly, to support staff so that they can do the best job that they can and we keep them safe. As leaders, these are two of your prime tasks. This is in addition to the clinical and operational work that you are responsible for. I know the ask of you is immense. Let me take this moment to thank you for what you have done and the leadership you are giving to so many people. There are a number of issues that I want to cover today. Firstly, PPE. It is entirely understandable that staff feel highly anxious. They wish to protect their families, colleagues, patients and themselves. We must do everything we can to protect them and keep them safe. We should not hide from the fact that we are all anxious that we may run out of protective equipment. Many areas are already reporting a shortage. This issue keeps me awake at night. The availability of supplies is being worked on almost every hour of every day. And I would like you to view Chris Brooks's video on our intranet. If we can keep to the guidelines he explains today, we will have enough PPE to protect staff that are at most risk from the virus. I would dearly like to provide protective equipment for anybody who wanted it, but we cannot. If we had this approach, the staff that are most vulnerable will be at risk. I can assure you that the availability of PPE receives my daily attention. Next, let me go on to testing. The government has announced that staff will be tested. We all believe this is a good thing and it needs to happen as soon as possible. And we await NHS instruction as to how this will be done. I need to say to you that it is my belief that there will not be enough testing capacity for at least another week, if not longer. We will be taking a risk-based approach to allocating tests, with staff and patient protection being the #1 priority. I said that one of my two tasks in this national emergency is to support staff. Early next week, we will be publishing a support package for staff. This will include things like providing your daily groceries, psychological support, health support, support for transport, accommodation, and a lot more. We are investing heavily in what staff need as people and not just as employees. We need to encourage staff to use this support as it will benefit them and their families. I would talk a lot longer about staff and you as leaders if I had the time. It is so important for all of us to remember that we are people, husbands, wives, daughters, sons, mums and dads. As leaders, we must consider the whole of our staff lives if we are to support them in the best possible way. We must support our staff, minimise the risk, protect their psychological safety so they are well today and avoid PTSD tomorrow. Now, let me turn to our operational plans for managing the impact of COVID-19. Firstly, I want to talk about the importance of our community and social teams. Their work is critical to managing this national emergency situation. If we do not keep as many patients in their own homes as we can, we will not be able to adequately isolate them from the virus and our hospitals will not cope. We are lucky to have so many excellent teams working tirelessly in the community. Over recent years, they have led a remarkable change in improving out-of-hospital services, enabling many more patients to remain at home. They are now massively accelerating their plans and engaging with primary care so that they are prepared for the crisis. They are fast developing the capability and capacity to care for patients that would normally be admitted or remain in hospital. Our leading edge work in integration is really bearing fruit. I'm so proud of what I'm seeing, and it's a real privilege to work alongside the community staff that are so remarkable. The work of our community and social care teams is of great importance to achieving the next must do. We need to ensure that every patient that is medically optimised leaves the ward in 1 hour and is discharged from hospital in 3 hours. The emergency changes to the Health and Social Care Act have been approved by Parliament to remove some of the pre-existing constraints that resulted in patients' discharges being delayed. I know what a significant change this is to our current way of working in hospitals. It requires a very different type of mindset. I know many care teams will be anxious about implementing this must do. They will not have seen at first hand the changes in the community that is required to achieve this must do. As a result, they may become risk averse in their decisions to identify a patient as being medically optimised. We must do our best to allay their anxiety. We must use our acute beds for those patients that really need this high level of care. Otherwise, people are going to die when we could have saved them. Next, I want to continue to emphasise that COVID patients are not the only patients we must care for, in or out of hospital. We are finalising plans to protect some hospital-based facilities so that we can continue to care for other critically ill patients, for example, stroke patients, cancer patients, patients requiring emergency or urgent surgery. We are working within national guidelines and our clinicians to determine what patients will require to treat in an emergency. We are working within national guidelines and our clinicians to determine what patients we will continue to treat as the emergency progresses and we see numbers of COVID patients rise. We are asking the clinicians to make some very difficult and ethically challenging decisions in order to protect patients that are most vulnerable and those that will benefit most from the reduced capacity we will have to care for non-COVID patients. I wish to take this opportunity to thank those clinicians that have been tasked with issues of such magnitude and impact that they are challenging their life's experience, and I'm grateful that they have stood up and risen to this challenge. In coming days and weeks, we will be needing many more clinicians to take on these challenges. I know that all clinicians will remain true to their value set and professionalism. The situation we face means that never have values and professionalism been more important. I can assure all of you that this organisation will give 100% support to all clinicians now and when we get past this national emergency. We know that with the benefit of hindsight, we will have been judged to have made mistakes. They are not mistakes, as we will have done the right thing at the right moment to the best of our ability. Dame Claire Marks from the GMC has released a video that is enormously helpful on this point. We are all making decisions under such difficult circumstances and pressure. The accountability for these decisions lie with the organisation and me as your CEO. Your professional bodies are also really helpful in giving us all reassurance on this point about accountability. So, let me summarise some key messages. Supporting staff and ensuring that they have the right equipment is a #1 priority. The importance of our community and social work team is critical, and we should have total confidence in them. We need to manage every acute bed as a precious life-saving resource. Values and professionalism will be what gets us through. Remember, be kind to each other and yourselves. I'm really sorry that this videocast isn't interactive today, and we're working on the technology to make it happen. In the meantime, if you do have any questions on what's been said today or any other questions, please email me on chief.exec@srft.nhs.uk. The email address will go out on some comms as well. So thank you for your time this afternoon, and thank you for the work that you're giving to your patients and in terms of supporting staff.